let's get right into the gym now. You know,
Right.
For an endurance athlete, for a strength athlete, but just fitness guy. What are we looking at here, like from the studies standpoint?
Okay, so the studies that they're very interesting. They're kind of all over the place. There was a systemic review and meta-analysis recently published in Pharmaceuticals, which is the journal I'm a guest editor of. But in the journal, they did conclude that the clinical studies indicate that drinking hydrogen water does appear to have this ergogenic effect in terms of its anti-fatigue effect and, helping with like endurance and things. So, your question talking more about, what are the acute, a lot of the immediate effects of hydrogen after you ingest it versus, say, the chronic effects. And they're both. And so let's talk about some of those acute effects first, right? So when you take just pure molecular hydrogen, you might notice, for example, in the gym, that your ability to do another bout of exercise or another set, for example, or be able to go to, or your ability to exercise longer is going to increase. In fact, they did a study in elite soccer players. It was a small study, 10 athletes, but they were doing these isometric maximal exertions of these knee extension exercises, and they found that the drinking of hydrogen water allowed them to perform better. They were not as susceptible to fatigue, right? And they also measured the lactate levels or lactic acid, as people call, and those levels were decreased as well. So we see that hydrogen is directly helping, in the mitochondria, for example, for energy production. So people can have this additional ability to exercise better and improve their workout performance. For like other endurance type exercise, in terms of like your cardiorespiratory fitness, your heart rate, you might notice that you can do the same amount of work with less exertion. Both actual physiologically, we can see this through measuring various submaximal indices of the exercise intensity, as well as your perceived exertion. Okay, hydrogen has this effect also on the mind in these placebo-controlled studies, where those on the hydrogen had a decreased rate of perceived exertion, as indicated by the Borg's RPE scale, for example. So in this way, people can, when they take the hydrogen water, they're going to notice they can exercise longer. It's not as difficult, and they don't get as sore, for example. And then there's some more studies coming out in terms of the actual performance enhancing effects, and those ones probably are going to come more over chronically, so over a longer period of time, because the hydrogen itself is directly benefiting your ability to train. And the better you can train, then the better your adaptations are going to be later on, right? That's why you want to have fast recovery.
Why is there not more research on this? What's going on with this?
Well, yeah, again, it's all subjective, right? I mean, it depends on your matter of perspective, because the reality is hydrogen only got popular around 2007. And popular by, I mean, being published in Nature Medicine. Okay, but now there's over 2,000 articles. That's like an exponential growth. Okay, look at something that we should also talk about, nitric oxide. But that was discovered back in the late 1970s or so. It took forever before it won a Nobel Prize in the 1998, and then it's only now that people are really getting behind, like, wow, nitric oxide is really good for us. Let's do something about it, right? So the research on hydrogen is actually growing at quite a rapid rate, and by universities all over the world. And again, this is not funded by some pharmaceutical company or just the industry or something. This is government grants, research universities. This is where we're getting the money from. And these funds aren't that big. And so we're not able to do, massive, studies. And you can't patent hydrogen. It's a natural molecule, right?
Thank God.
Right, yeah. Yes. I mean, you can patent, certain ways to deliver it and things, but it's a little bit complicated in terms of like a pharmaceutical company getting behind this.
It's really cool, and I can see what you just explained with nitric oxide, or my during or my post-workout, and I want this much more of just making sure that I'm killing it. I'm going to be doing so. I'm going to be looking into that. That's how I do it. That's on top of everything else with diet, exercise, meditation, and medicines. And this is kind of like this bridge now where we're entering into this incredible field using technology and real science Dr. LeBaron,
Yeah,
thank you so much.
it works perfect what you said. Just to end on that note, is hydrogen really helps as a modulating molecule to bring things back to homeostasis.
Right.
That's what it's key at. It's not a drug's going to push you out. It's going to bring you back to homeostasis. And people, if they're interested, they can look more. My organization, my nonprofit, molecularhydrogeninstitute.org. We're a 501c3 nonprofit. We have a lot of research there, a lot of education there you can learn on. We don't promote or endorse any products, but we are focused on the education. I will say that there are some products that are not good out there, so be careful. I know you're going to try some new hydrogen products coming up. I'm interested to hear your experience. We're at Mr. Olympia, and we'll talk more about that and some of the research that we have done on some of those specific products that you're going to try.
It's such a pleasure having you, Doctor. It's so cool, and we're such on the cutting edge, bleeding edge, but it's real science.